What is a colonoscopy? Colonoscopy is a procedure used to see inside the colon and rectum by using a flexible endoscope, which is 160 cm in length and has a 1 cm diameter. At one end of the endoscope is a magnifying lens, while the other end is connected with a light generator that transmits an image to a monitor screen. A medical doctor will use the endoscope to penetrate through the rectum up to the colon adjacent to the intestine. Colonoscopy can detect inflamed tissue, ulcers, abnormal growths, and cancer. The procedure is also effective in diagnosing any abnormalities of the colon, for example, abnormal digestion, chronic diarrhea, and constipation, unusual stools, pale condition, weight loss with unknown reasons, abdominal pain, abnormal growth in abdomen, bleeding from anus, or cancer in the family history. How to prepare for colonoscopy? The doctor usually provides instructions about how to prepare for a colonoscopy. Patients should abstain from vegetables, fruits, and other high-fiber foods at least one day before the colonoscopy in order to take less time for a bowel prep. A doctor may advise you to take either a laxative or an enema before the colonoscopy. A laxative is a medicine that increases bowel movements and loosens stools. Prior to the procedure, stools indicating that the patient is ready for the colonoscopy must not have any fiber in them. They should be yellowish and translucent, like urine. Laxatives are usually swallowed in pill form or as a powder dissolved in water. An enema is performed by penetrating a small, soft plastic tubes in the anus and then flushing water or saline solution to clean up the anus. Before colonoscopy, patients should abstain from food and drinks for at least 6 to 8 hours. Patients should inform the doctor of all medical conditions, medical or chemical allergies, including any special caretaking before the treatment. They should also inform the doctor about all medications taken regularly, including aspirin, arthritis medications, blood thinners, diabetes medications, vitamins that contain iron. Before taking this treatment, patients should plan to have a friend or relative take them home. Patients should not drive within 12 to 24 hours after the colonoscopy because they may still be affected by the sedative. During the colonoscopy, patients will receive a sedative through their vein to help keep them relaxed. While patients are sedated, the doctor and medical staff will monitor vital signs including pulse, blood pressure, and oxygen level. This is done throughout the colonoscopy and the recovery phase. During the treatment, the doctor will gradually penetrate an endoscope into the anus, up to the colon, with the assistance of images in details of the colon tract that are displayed from a video camera to a TV screen. Air will then be pumped through the endoscope in order to inflate the colon. This enables clearer images and allows special tools to perform biopsies, stop bleeding, and remove abnormal growths. While the colon is being inflated, patients might feel some discomfort. The doctor will then try to absorb the air as much as possible during the withdrawal of the endoscope. After the colonoscopy usually takes 30 to 60 minutes. After the colonoscopy, patients will be taken care of in a recovery room for about 2 hours. Cramping or bloating may occur during the first hour after the procedure because of some pumped-in air left in the abdomen. Patients will feel better after flatulating. This symptom will disappear within 24 hours. If the doctor finds any abnormal-looking tissues during the colonoscopy and suspects them to be harmful, samples can be taken immediately. This procedure is called a biopsy, and it does not cause any pain to the patient. Patients are informed of the result of their colonoscopy that same day. Biopsy results are usually ready within 1 to 3 days. The risk associated with a colonoscopy can be the accidental puncture of the colon wall, including bleeding after a biopsy. But these risks are very rare. Patients who develop any of these side effects should inform their doctor immediately. Severe abdominal pain, fever, bloody bowel movements, chest pain or chest congestion, exhausting,